The Montana Obstetrics and Maternal Support Program, known as MOMS, was created to connect rural providers to obstetrical, gynecological, perinatal, mental health, and substance abuse specialists to build competency and consistency across perinatal providers. MOMS provides simulated obstetrics training for rural healthcare providers involved in the treatment of expectant mothers. ACOG Echo and SIM-MT training provide hands-on opportunities to practice individual skills and the critical teamwork and communication skills necessary to care for patients during obstetric emergencies.
I think what we want to achieve with the MOMS project is to elevate the standard of maternity care in Montana and sustain that level. And I think we can do that by teaching our doctors, nurses, the teams that are delivering maternity care to do simulations, to do practices, and not only have us as the instructor, but to instruct each other, to train the trainers.
When a woman is pregnant, outside of maybe when they're driving down the interstate, that's the time in their life when they're at the highest risk of actually dying, and I don't know that a lot of people realize that.
Montana's #6 in the nation for maternal mortality, and the goal is to decrease that number through this MOMS program and training.
Well, Montana is a huge state. We have a sparse population. We have long distances between our hospitals and some very small hospitals that are doing critical care for the community in Montana. Small hospitals are challenged to meet the same level of care that big hospitals have.
Traditionally, a lot of us are trained with this high level of stress, and what has been found is that a lot of times providers then take that stress with them into their care of the patient.
Some of the biggest challenges that we face as family docs caring for mothers, I think really is dealing with the lack of predictability of what can happen when a woman is pregnant and in labor. 90% of the time it goes just fine, and the other 10% things can change rather fast, and we're really doing a difficult balancing act and dealing with a lot of high emotions, and that goes for us too.
So with simulation training, we're practicing for critical events that happen rarely. What makes this unique is that we're taking the simulations to the place where the patients actually are and that the care is being delivered. By practicing over and over, not only with us virtually or with the simulator there, but by doing their own simulations, they've created great teamwork, and when the problems arise, they've been able to address them.
MOMS worked with ACOG to pilot one of the first virtual Echo instructor courses taught by Dr. Shad Deering. Over Microsoft Teams, Dr. Deering trained 12 Montana doctors, nurses, and nurse midwives to be ACOG Echo instructors. Dr. Christina Marchand utilized the training and equipment provided for the Echo course to train provider teams at Central Montana Medical Center on various obstetric complications utilizing a Mama Natalie simulator.
And if we do 80 to 100 deliveries a year, they're doing 1 or 2 deliveries a week for a little bit, and then they might not do a delivery for a month. And so, if everything goes well, 90% of the time, they might not see a postpartum hemorrhage for a while. And we did the simulation, and they did the precipitous delivery, and then they went into the postpartum hemorrhage, and we ran it like 4 or 5 times, so that we're really up to date on it, and we were doing TXA. And then Dr. Simpson walked by and hadn't known that we were doing all this stuff. He's like, "Hey, what are you guys doing?" And I said, "Oh, well, watch out, we're doing postpartum hemorrhages." So I winked at him, and then within a week, he had probably one of the worst postpartum hemorrhages that we've had here in probably 6 years.
I had a patient who had a very nice vaginal delivery. Everything went pretty well. Sort of fortuitously, our nurses had recently trained in a hemorrhage scenario with some MOMS materials, and that turned out to be really helpful because this patient, after everything had gone pretty well, started to hemorrhage after she had the baby. So thankfully our nurses were very ready for that. I'd been working here a few years at that point, and some hemorrhages in the past, I was doing a lot more coaching and asking specifically for things that I needed. But at this hemorrhage, there was a definite improvement in our staff knowledge, how quickly people were able to get things. We were able to give tranexamic acid and Methergin and a lot of the other medications that we needed to give very quickly. And we also were able to draw blood quickly. People were just much more prepared for some of the nitty-gritty tasks that we needed to do to take care of that patient.
And it was great because He said that everybody was really up to snuff on everything. They knew where everything was at. And we had actually had, at one of the trainings, had our ER nurses there to do some of the simulations as well. And so when he had this hemorrhage, everybody was really prepared.
But we took as good a care of her as I think you would get at any other hospital, and I was really proud of everybody for doing so well with that. I don't even think she quite knew how bad things were. She recovered nicely without any complications, and both her and the baby are doing great. It was really nice to have the support of moms to do the hemorrhage simulation and training recently, and we're looking forward to doing a lot more training for scenarios with the support of moms.
SimMT trainings provide on-site mobile simulation services via high-tech simulation trucks capable of training a multitude of medical emergencies. Thus far, MOMS has utilized SimMT to provide trainings to non-birthing critical access hospitals who have been or may be required to deliver in their emergency departments due to their distance from a birthing facility.
Simulation in Motion Montana's mission is to provide high-fidelity education to healthcare teams across rural Montana.
Our overarching goal is to create realistic training in a psychologically safe learning environment. And so what that means is we want to create just enough stress and decrease some cognitive load.
Sim Montana's collaboration with moms has been really well received. By collaborating with them, we're able to reach a much larger audience and to actually create stair-stepping simulation experiences so that we can gather data to see the impact that we're making. These high-fidelity mannequins can do nearly anything a patient can do. They can talk, they bleed, they have pulses, they give birth.
I'm feeling dizzy.
And we were able to change vital signs and other parameters so that the case feels as if this is a real mom who's really preeclamptic with a high pressure building. They can administer any of the medications they need and any of the interventions they need, just as if this patient were really in their emergency department.
We had a chance in a safe learning environment to work and to learn amongst the team of RNs and physicians that we've got working with us. It helped us delineate our roles a little bit more if the situation were to come in.
So once we conclude the simulation training itself, we take the learners and we sit in a round table and do a debrief discussion, which is a really unique opportunity. A lot of times facilities are so busy that providers aren't afforded the opportunity to really discuss the nuts and bolts of a case. And that's what simulation provides. So they're able to go sit back, we're able to talk about what went well, how they worked cohesively together, if they felt there was anything they could improve upon in the training in hindsight.
Through MOMS, healthcare workers across rural Montana also connect with each other to provide community, support, and an exchange of ideas.
And I think one of the biggest problems in medicine is burnout, and burnout has one of the biggest contributing factors is a sense of isolation and a sense of loneliness and a sense of the lack of autonomy and ability to do things. And one of the treatments for that is community and networking, and MOMS provides that.
Doing obstetrics in a rural area, one of our biggest challenges is distance. And we have very few people spread over a very large area here in Montana. And so one of the nice things about MOMS is that we're able to form a community and meet some of the other providers who we've talked to face-to-face and maybe seen some presentations on. And that helps a lot with coordinating care when we need to transfer a patient to a larger city. And gives us a lot of ideas and resources that we can implement with our own staff and improve the way we do things.
I feel like because of the MOMS grant, we were able to get the stable, the NRP, and all of these trainings to our facility. And I don't believe without that grant, we would be able to learn as much as we have in the last few weeks.
Montana is known as the last best place for our beautiful and plentiful open spaces, including our rural communities.
We strive to make the last best place the first best place to have a baby.